नमामि धन्वन्तरिमादिदेवं सुरासुरैर्वन्दितपादपद्मम् लोके जरारुभयमृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौकां दधतं मृतघटं चारुतोर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरुद्यं शुकपरिविलसन् मौलिमम्भोजनेत्रं कालाम्बोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यं वन्दे धन्वन्तरिन्तं निखिलगदमिव प्रौढदावाग्निनीलम्। नमामि धन्वन्तरिमादिदेवं सुरासुरैर्वन्दितपादपद्मम् लोके जरारुभयमृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौकां दधतं मृतघटं चारुतोर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरुद्यं शुकपरिविलसन् मौलिमम्भोजनेत्रं कालाम्बोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यं वन्दे धन्वन्तरिन्तं निखिलगदमिव प्रौढदावाग्निनीलम्। नमामि धन्वन्तरिमादिदेवं सुरासुरैर्वन्दितपादपद्मम् लोके जरारुभयमृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौकां दधतं मृतघटं चारुतोर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरुद्यं शुकपरिविलसन् मौलिमम्भोजनेत्रं कालाम्बोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यं वन्दे धन्वन्तरिन्तं निखिलगदमिव प्रौढदावाग्निनीलम्। वन्दितपादपद्मं लोके जरारुभयमृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौकां दधतं मृतघटं चारुतोर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरुद्यं शुकपरिविलसन् मौलिमं भोजनेत्रम् कालाम्बोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यं वन्दे धन्वन्तरिन्तं निखिलगदमिव प्रौढदावाग्निनीलम्। नमामि धन्वन्तरिमादिदेवं सुरासुरैः वन्दितपादपद्मं लोके जरारुभयमृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौकां दधतं मृतघटं चारुतोर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरुद्यं शुकपरिविलसन् मौलिमं भोजनेत्रम् कालाम्बोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यं वन्दे धन्वन्तरिन्तं निखिलगदमिव प्रौढदावाग्निनीलम्।
Welcome to respected delegates, our respected speaker on this Rishi Ram Koirala, Dr. Rishi Ram Koirala Memorial Series. I welcome to all of you, and this is an international webinar series which is just organized on the memory of Dr. Rishi Ram Koirala. He is a very well-known clinician of Nepal, and we are very much proud to inform you that he has given so many lectures in Ayush Darpan platform. So Ayush Darpan, as well as the Nepal Ayurveda Medical Students Society, that is the NAMSS, as well as the Vabeda Private Limited Sri Lanka, and the Felix Gen Bangladesh, jointly organizing this program. And this program is supported by Vishwa Ayurveda Parishad Nepal and Ayurveda Health Home Kathmandu, Nepal. So I welcome, I am Dr. Naveen Joshi. I am from Dehradun, and I am just founder of this Ayush Darpan Foundation Trust. I think that you all are audible. Yes, so I welcome so many participants have joined here. So without wasting the time, I'm just informing you today the topic of a very relevant topic, and it is the Ayurvedic understanding and the management of muscular dystrophy. You all know that this is a very rarest problem in which there is no very limited treatment, and Ayurveda has certain hope. So we have two speakers today, Professor Dr. Ajayan Sadanandan, as well as Dr. Vishwanath Vashedkar. So I welcome all the participants who have joined here. I am just looking that 24 participant has already joined, and I hope that many of other participants will also join. So from the Nepal, India, as well as the other Sri Lanka and other countries. As Dr. Rishiram Koirala is very, very popular, internationally very popular physician. He was very popular at the health home he established, giving consultation to so many patients. So, actually his command over the Kaya Chikitsa is very commendable. And actually we have organized so many webinars in which he was as a guest speaker. You can watch these lectures on the Ayush Darpan General's timeline. And yes, but the memory of him is just with us. So हम आपको सबको स्वागत करते हैं. And now I welcome to all of you. And then so Suman K just here. Suman Khanalji is from Nepal, and he's also a dynamic person. We just actually the motto behind this webinar and planning, the key planner of this webinar is Dr. Suman Khanal. So I welcome to Dr. Suman Khanal also. So now, without wasting the time, I'm just inviting Professor Dr. Ajayan S, who is MD, PhD from, as well as he's from Sri Kesavan Vaidyan Memorial Vaidyashala, Kesavalisam Compound, Kaimanam, Tiruvantapuram, Kerala. And I'm just making you, sir, co-host, and I'm just giving you a brief biodata. He is a member of Documentation of Local Health Tradition and Ethno-Medical Practices, CCRS, Ministry of Ayush, Government of India. Documentation of Marma Chikitsa, very nice, CCRS, Government of India. Institutional Ethical Committee, AVP, Coimbatore. As Ayurveda Research Institute for Panchkarma, Thrissur. Conducted numerous ethno-medicinal studies on Kerala, Tamil Nadu, Karnataka, Telangana, Andhra, Maharashtra, both Western Ghats and Eastern Ghats under AMAI 3-day in-house field study program on Tatigadu Bird Sanctuary and Urlu Matani on annual training program. As well as born and brought up in a traditional Agastya Marma practicing family, and you all know, grandson of late Brahmasri O. Kesavan Vaidyan Trivandrum, Ayurveda College first Marma head who contributed the famous Murivanna combination to the public, as well as many working for plant conservation, education, protection, and multiplications by all possible ways. So he's also a recipient of the Best Consultant Award. I think that Dr. Ajayan, sir, I am just welcoming to you. And just now this stage is yours. And I'm just giving you the share screen option. So I think that we all will enjoy your presentation. As I am just informing you that this lecture is now live at the Ayush Darpan Journal's Facebook page, where 30 to 35,000 doctors are there. And after some time, this lecture will be available on the YouTube also. So welcome, sir.
Namaste, sir. Thank you. Good evening to all. So thank you, Naveen Joshi sir, Suman Khandal sir, Vishwanathan sir, and it's a great pleasure that I can share some of the important aspects of Agraushadhas in this platform. So on the remembrance of Dr. Rishiram Koirala Memorial Webinar Series. Thanking all of you for giving an opportunity to share some of the information regarding this importance of Agraushadhas in clinical practice. So we know that Agraushadhas are innumerable in number. We are using that for various types of clinical conditions. And this will be very useful that if you know about a particular drug pharmacological action and its range of its potency in various levels, then it will be very easy to apply this drug in different diseases. If we don't know about the disease also, disease name or disease character features and other things, but looking into the symptoms and the dosha vitiations and where these doshas are vitiated in which dhadus and how it will be producing a srodha dushti in that particular.
If possible, you can just put full screen of your slides, and it will be better.
Yes, surely. So by looking into that aspect, we can choose the drug in the prompt clinical conditions. So if we know about the dynamicity of a particular drug, then surely we can utilize this drug in various disease conditions. So agraushadhas are such karma pratyaniga, more potent drugs that can specifically act on these types of problems. It may be in a rasadhatu or shukradhatu, like that. If the vigara is occurring in that particular dhatu, we can choose these drugs that for particular purposes. For that purpose, we can go through some of the important agraushadhas that mentioned by our acharyas and that are easily available, and we can use it in a very good form for our clinical purposes. So we can go through that. Guruve Namaha. Om Sadguruve Namaha. Om Prapancha Shaktyaya Namaha. So with all your permissions, we can go through the agraushadhas utilization in clinical practice. So first we can see what we mean by agriya. Agriya means the pradhanam, uttamam, one which is most shreshtham. And the synonyms are given is mukhya, varnya, agriya, agriya. So this shows that this is the drug which will promote a pradhanam, the foremost, topmost thing that is essential for a particular purposes. That is the agriya. And when we see the agriya aushadha, the different references that Acharya is given is agriyanam cha vikara shamagatva vidhanam pradhanyam uchade. Why agriya aushadha is important means it can promote a vikara shamagatva. It can do a pacification of a particular disease by its potent karma. So agriyanam balavat karmagarini, that's the Shivadasa is coming. So one which can do a strong, strict action on a particular complex thing, then that is termed as agriya aushadha. So one which promote a prasastha karma for a particular condition. And again, Acharya is telling that Joradi Jnanam api vikaranam vikadaya samarthyam bhavat. So it can do a vikada samarthyam. So here we can see that vikara vikada means it is capable to promote a samprapti vikadana in that particular conditions. So we all know that there will be a dosha dusha samurchanam and a srodha dushti is occurring, and that will lead to a particular disease. So a single drug that can able to promote a dosha dusha samurchana vikadana and can capable to do a specific karma of that condition. So on that instant, we have so many drugs which has having such a prasastha karmas. But multi-dimensional pharmacological action promoting by certain dravyas that chosen by our acharyas, and that is kept in our agraushadha. And here you can see that Acharya is telling two types of karma is doing by the dravyas. One is anutpannanam. It can able to promote an reoccurrence of the particular disease. And second is swastha paripalanena. So agraushadhas are drugs which can able to provide an anutpanna of the disease, reoccurring of the disease, and it can capable to promote a swastha paripalanena. So this shows that these dravyas are having a peculiar type of action on that particular dhadus. So that srodhasas strengthening and functional activity is properly maintained by this Agraushadha. That is why these are very important. So each and every Agraushadha has an Pratenigatva, an affinity towards a particular dharus, and it will help to promote an ideal Srodas for that dharus. And we know that the Srodas and the Srodhamula. So both these are balanced by these drugs, along with the karmas that promoting by these areas. So it can promote a particular type of karma on these Srodasas also. So normally also it will provide a strengthening to that particular structures. Same time, if any disease is occurring, it can able to pacify that particular disease. That is the speciality of this Agraushadhas. So like that we are discussed already. We have two sets of things done by these dravyas. One is Srodho Pratenika and another is Vyadhi Pratenika. So this is each drug has a specific affinity to a Srodasas, and it is affinity to heal out something that will be occurring on the particular Srodas. And it is a Vyadhi Avirodhi. In any Roga Avastha, it can be used as a Rasayanam or Pathyam also. So if you want to use a particular drug, example, we can take it a Musta. Musta you can utilize in any types of Jara without irrespective of any other conditions. That's why we can use it in the form of a payam. We can use it in the form of a takram. We can use it in the form of a medicine. Like that, we can use multidimensionally these Agraushadhas in various forms in such type of a Vyadhi combinations. So when we're coming to the prescriptions, when a patient is coming in front of you and when we are starting to write a prescription, the first drug what we have to come into mind is the most important drug that is essential for that patient. That is the pradhanam, the most important drug what we are choosing. So if a patient is coming with a Vada Vyadhi, we have a plenty of yogas are in front of us. But what the thing you are writing, according to the choosing of the patient's condition, that is important. So if you look, we can see that Bala Sangrahiga Vadaharanam. If you see the Rasna is Vadaharanam. Erandamulam is Vrishya Vadaharanam. So we have to choose which drug is essential for that particular patient. So if a patient is coming with a 2 week physical quantity and we need a Vrishyam, then we have to choose Erandamula as the Vrishya Vadaharanam. And if a patient is having a pure Vadaja problem and he has some very difficult conditions of the Vada with Karshikarshanam, all these are very much predominantly present, we have to depend upon the Rasna. So on that time, our mind will go to the Rasna Adi Kashayam or Rasna Saptagam, Rasna Panjagam, like that Kashayam. So if it is another where there will be a patient is coming with so much of tremors and weakness and having an Indriya problems, sense-oriented problems or touch sensational problems, our mind has to go into where is the Bala. Because Bala is such a drug which can promote such type of a balance of Indriyam and other things. Vada pacification something. So like that, in the prescription, the first drug for the choice is the Paradravyam. So when you are applying the Paradigunas in making a prescription, the first drug is Para, the most important drug. Most of the time, the first drug will goes to the Agraushadha. So Ajara is telling that Parachikilsa Vidhaneni, Agraushadha is very important. So selecting a particular dravya which is most potently acting on that particular disease also very important. Like that, when we go through our clinical conditions, what we are seeing in various disease conditions, we have a specific type of set of problems or functional derangements that are occurring in our body. The main thing is the Agni. So Agni, most of the time, if it is deranged, then it will lead to various types of disease. Sarvarogo Mandagana. So we need a Amapajanam and Agni Divanam. So we have to depend upon Divaniya Pajaniyam. In all these conditions, commonly you can see that in most of our Srodasas, we need a particular type of Sangrahito. Sangrahi means something which can able to prevent or something which can able to straighten out constrict out or to prevent the excessive things that is happening. So in the most of the time, any clinical conditions like sneezing or sometimes adisaram or sometimes excessive sweat or sometimes there may be an excessive movement of some muscles of the face or the body, everywhere we need a sangrahana. A sangrahana means one which has promoting a mushti bandhanam, dradagrahanam, something which can hold or things that is, that sangrahi. So if in the first stages of the pregnancy also, we want to prevent a abortion and proper placement of the fetus, we need a sangrahi. There also we need a sangrahito. If we want to keep our brain and the functional activities in the proper way, there also we need a sangrahanata. If any excess things are occurring, then there will be a sangrahanata will take place. If a bleeding is occurring, there also a sangrahanata may occur. So in the conditions like in the Agni derangement, the conditions like the dadus where the rasam or rectum is involving, or there will be an excessive movement or something is happening in the pranavagasrodhas or udavavagasrodhas or mutravagarodhas, there we need sangrahi. And wherever there will be a vada aggravating, there also we need a sangrahi. So in the Agraushadhas, Acharyas are mentioned three important sangrahi groups. One is sangrahi dipaniya pajaniyana, another is sangrahiga rektapitta prashmanana, and third is sangrahi vadaharana. So most of the times in the amavastha of the diseases, we need sangrahi dipana pajaniya quality drugs. When there will be excessive bleeding or something is happening, where there will be recta is the most important thing, and it will be excessively going out or its functional aspect is excessively taking place in the Rektapittam or Kamala like conditions also. We need Sangrahi Rektapitta Prashmanana. If in the Vada Vyadis, there will be an excessive activities of Vadam associated with Kapha or Pitta, or it will be involving in any other Dadus or mental derangements, there we need a Sangrahika Vadahara. So like that, when we are seeing the Agraushadha karmas, we can see Sangrahi Dipaniya Pajaniyanam, Sangrahi Rektapitta Prashmananam, Sangrahika Vadahara. This can be seen in all Dadus. Even in our Manasika Rogas also, we can see these types of involvement. So selection of these karmas from a particular drug and utilizing for that purpose is one of the important things. So here first we can see some of the applications of Sangrahi Dipaniya Pachaniya quality dravyas. So if we look into that, we can see that Musta Sangrahika Dipana Pachaniyana, Adivisha Dipaniya Pachaniya Sangrahika Sarvadoshaharana, Vilva Sangrahika Dipaniya Vada Kapha Prashmanana. So like that, simple Sangrahi Dipana Pachaniya, Acharyas used various drugs according to the Srodho Pratyanagatam, according to the Vekta, where it is acting more. Some of the drug will act more on Ama Pakvashya, the Udbhavasthanas, where some of the drug will acting on only on Amashya more. Some of them are acting more on Pakvashya area. According to that, Acharyas are select certain specific Vyadhi Pratyanika dravyas that can do a potent action. So we can see one by one regarding the each of their actions. First is Musta Sangrahika Dipaniya Pachanyana. So we seeing the Musta itself indicative towards a specific type of character features. One of the synonym is Anupacha. So a plant which is occurring on the Anupadesha, water areas it is occurring. And Grandila, so it is having a small nodules like these tuberous outgrowths with a wiry stem, wiry root. So this indicates that a plant which is growing on a watery area and it is having the nodules and it is liked by the pigs, Crodesta. So a animal which is intaking this tubers, and that animal is living in a most polluted and decayed areas. So that animal is eating because to prevent such type of inflammations. So this drug, wherever there will be an inflammation that is occurring in our body, especially on the Rasavagasrodhas and Annavagasrodhas, we have to depend upon this musta. So that's why it has an intense capacity to produce such type of an action in our body. And if you look into the Rasa Panchaka of this drug, we can see that this is having such a type of specific affinity of producing Tikta Kadu Kashaya Rasam. So it's a predominant of Tikta Kadu Kashaya Rasam, Legu Ruksha Guna, and Shida Virya. So Shida Virya, Legu Ruksha Guna, and Tikta Kadu Kashaya Rasam, along with the Kadu Vipak. So this drug has having a specific affinity towards Rasavagasarodasas and Anavagasarodas. So whenever there will be a primary inflammation is taking place, this drug can able to subside that preliminary inflammatory conditions. Because whenever there will be an inflammation, there will be an edema, there will be a lymph node enlargement, there will be a heat will originate. So heat and inflammation and edema is the cardinal feature of the inflammations. So especially in the first part of these inflammations, we can depend upon a Shita Virya Yukta Laguruksha Guna Tikta Kaduka Shaya Dravya that can classify these things. So in that aspects, if you are seeing, it is a drug which is extensively used in Annavagasrodas. That's why Jora, it is one of the important thing. In Adisara, it is one of the important thing. In Grahani, it is one of the important thing. So Ama Pakwashe Udbhava Rogas, it is one of the predominant factor in the Abhyantara Roga Margam. And at the same time, if you see the Bahya Roga Margam, we can see the usage in Visarpa, Kushtam, and excessive sweatings, all like conditions. Like that, there is a plenty of yogas are there in our classics. So we are not going to that aspects, but we can say that there will be a choice to Vaidya that any prescription if you are doing on that, if you include this musta, then it will be very useful for doing a Deepana Pajanatvam and Joraharatva or Adhisarakana like conditions. That way, if you see that it is included in Lekhaniyagana, in Krishna Nigrahana, Kandukna, and Stanya Shodhana. So here we can see that Stanya Shodhana is one of the important, because in Rasadadu we can see that it is the Stanya is associated. So in Stanya problems also we can promote this in a very good form. One of the usage in Stanya problem is Musta Churna. It can be used with the breast milk. 3 grams it is given along with the breast milk to the children, then it will be good for the children. And if it is not possible, we can make a Shiram also. A Shirapaga of this Musta Churnam is good in Amadisara. So if it is in Amadisara, we can make a Shirapaga. If Musta Churnam is given along with the Madhu, it will be useful in Prabhaviga. So like that in Adisaram, Amadisaram, and even in Rektadisaram also, along with Prabhaviga, we can use this one. And in Grahani, there will be a very good usage is Musta Takram. Samyojya Musta Nishkwade, Shridena Payasam Samam, Siddham Takram to Sangrahi Grahani Doshanashanam. So we have to make a Musta Kwadam, and to that add the milk, and then again to make it into a Kashaya, Shirapagam, and then we have to make it into a takram, and that takram is a very good for Sangrahi Grahani Doshanasana. So in South India, this is one of the important preparations that advising to the children's by the pediatrics Vaidyas. So it's a reference from Arogyaraksha Kalpadruma. So Musta Takra is one of the important things. And in Stanya Dosha, so if you want to promote a purification of the breast milk, and maybe this breast milk impurity will lead to the problems to the children. So if we want such a type of purification as a Stanya Shodhanam and in Sthana Shoka, the edema that is occurring on the breast also, Musta Kashayam, simple Musta Kashayam is also very effective. In these conditions, the same type of problems, we can use another way also. Externally make the paste of Musta on the breast areas, and after 45 minutes it will be washed off, and then the breast milk is given to the children, then it will not affect the heaviness of the breast milk. So Gurutva of the breast milk can be reduced by this process. So like that, this is one of the important thing. And another is, we already discussed that it is a very good for Rasavagasrotas. And in excessive sweating, and there will be a bad odor in our body. One of the method is usage of snana churnas, powders that can be used for external application when we are taking bath. So Musta Churnam is one of the good thing that can remove this bad odor. So like that, in Joras, Adhisara, Grahani, Kushta, Visarpa, Vadaroga, we can see plenty of yogas, even in our Pajana Kashayas, like Khana Chandana, Shundya, Ambu, Parpado, Ushira Saditam, Shida Toya Pyoktam. So like that, in different places we can see the usages of this. So when such type of patients are coming with these types of problems related to the Rasavakas Rodasas and Abhyandravaka Rodasas, specifically to Amapakvashya origin, and the Bahiroga Marga, where there will be skin, there will be an excessive secretions are occurring, we can use this one. That's why if you see the Dakradaras, Musta is one of the ingredients in Takradara. Because of its Sangrahana action, it can promote in our head. So whole body, it can get a Sangrahana action. And if you see the usage of Musta in various other places, like Marma Bikhadas. So in an acute Marma Bikhadas, we have Mustadi Marma Kashaya. So that specifically indicates that when an acute inflammation, a sudden inflammation is occurring, there will be a heat, there will be a edema, and there will be a pain. So in all these conditions, this is one of the good drug of choice. And moreover, this is one of the very good Krimiknam also. So in Krimi conditions and in various types of itching over the body, on these conditions also we are using. So if you see the yogas of Visarpam, where there will be a predominance of kapha is there and itching is there and srava is there, you can go for a sangrahi, one which can string out these things by this Musta. So like that, Musta is a drug of choice for such type of diseases, of especially from the Rasadhatu. So Rasadhatu is one of the important dhatu that can do all the other things in a very good manner. So Acharya Sushruta is telling that the Rasadhatu, if it is properly circulated to the body in the form of curves, in the form of Tarangarubas, in the form as in Jala and other things, and it will do a very good two things. One is it can promote a Poshya Dhatu and a Sthai Dhatu. So if we want a Poshya Dhatu and Sthai Dhatu derangement in some diseases, one of the ingredients we have to look is Musta. So it can be ranged to different levels because it is a drug which is acting on the first part of our digestion and conversions. Especially it has having a specific action on the Samana Vayu. So Samana Vayu is one of the Vayu that is specifically situated on that Amapakvashya area, which will help in the promoting of the Agni in the proper way, and it can capable to do the sanchara of the things or separations of the things from Koshta to other Dhatus. So such type of derangements is occurring. You can see that Musta will be one of the important ingredient, or it can be added as a Prashevaka Dravyas or something like that in the particular conditions. So like that, Musta is one of the important thing for such type of disorders. And if you are going to little bit down of the Koshta from the Amapakvashya area to the other part, we can see another drug that is suggested by our Acharyas, which can promote a very good action on Pakvashya especially. And it can promote a very good action of Dipaniya, Pajaniya, Sangrahika, Sarvadoshahara. So all the doshas, one which promote a Dipana Pajana and Sangrahana, and on the dosha haranam can be taken, keep away by these things. So one of the thing is this plant is also occurring on a watery predominant area of high altitude, nearly 2,400 to 4,000 feet height, where there will be ice and cold weather is there. On that, a rhizome is occurring, and that rhizome has to sustain in such a type of environment. It has to produce so much of chemicals that can repellent against various types of bacteria and fungus like that. So automatically, if that plant will repelling against such type of things in a habitat of very cold, then surely it is having a constituents which can do a Krimikna action. And it is one of the best Kabahara Dravyam also. That's why in the first stages of the birth and after the development in Balavastha, this is one of the important drugs that we have to choose in any diseases. Because there will be a chances of Kapha Kala is predominant, and that Bala is having Kapha predominant, and Agni will be deranged, especially in the Ama Pakvashayam, and Pakvashaya is the main thing. There we have to select a drug which is called as Shishu Peshajam, because it is useful in Chardi-like conditions that can be occurring on that particular area, and it will be is as a Vishaknam, and it is a Adisaraknam, Choraknam, Grahaniharam, Kushtagnam, Visarpam, like things will be there. And it is useful in Vadarogam also. So even in our specific Kashayas like Rasna and Adi Kashayam, like that, also this will be coming. So this is a drug which is having a specific action on that particular level, and it has also a very good action in the rest of our cirrhosis. So those diseases which has taking occurring on that particular area, we have to depend upon these types of drug which is having these types, this property. Because here we need to increase the pitta more. The Agni will be more ignited on that particular area, and we need a Deepana Bhajanatum that will be deep seated into other levels also. If that will be that disease is occurring on Rasavasrodhas to Rektavasrodhasas and to the Mamsa or Medasas, we can depend upon Adivisham for that purposes. And we can see the usage of these types of drug in various levels, especially in the Jara Chardi. Adivisha Churna, 3 grams with honey is mentioned in Ashtanga Hridayam. And in Adisaram and Grahani like conditions, the Adivisha Churna, along with the Dhanyaka Kashayam is mentioned. And in difficult Amadisaram and Pitta Adisaram, Adivisham Indreva Pudajatok, a combination is mentioned in Vaishyajaratnavali. That is a very effective thing in even in IBS like conditions and certain unetiological conditions where there will be we are unable to treat the abdominal problems like that. We can select this Adivisham Indrevam Pudajatok combinations. And the most important thing is the present pharmacological studies shows that this drug is having a diterpene alkaloids and amorphous alkaloids like a heterophylline like that. This is having a multidimensional activity on various types of bacteria like gram negative and gram positive, these things. And even it has having very good action on the tubercular conditions. So even it is having a specific action on tuberculosis like conditions also. So nowadays we know that there are so much of abdominal related tuberculosis and other things are occurring nowadays. So this drug can be one of the good choice for that particular conditions also. Like that, it is one of the member of Trigarshikam, Chadrapadram like group that will be very effective in Krimi and Kapha like conditions. Even in Amavada also we can use this drug. Those diseases which is occurring in these areas, and it will be spreading up to the Sandhis also. Even this drug has a specific action on Madhyama Roga Marga. So where there will be Marma, Asti, Snayu, Sandhis, where there will be Amatomi is there. And there also we can depend upon this drug for promoting that action. So another drug that is essential from the Koshta to the Shagas, especially in the upper part of the area, where there will be an Udhana Vayu is involved, where there will be a Prana Vayu is involved. On that conditions, we can see another drug that is formulated by that. Acharya is Villum Sangrahiga Deepaniya Vada Kapha Prashmana. So we nowadays we know that the important problem that is occurring on the lungs is the accumulations of kapha. So these types of kapha accumulations, and it will producing a predominant Vada Kapha features. On that, difficulty in breathing, and especially the breathing difficulty along with the chardi like conditions or hiccup like conditions, we have to use this Billomulam. That's why it is having a specific action on Amashayam, and at the same time it is action on the Udhana Vayu and Prana Vayu. So Billu is a drug of Lord Shiva, and that will help to keep our prana in the proper level. So if you see the Shwasagasa Chikitsa, if you see the Kikka Chikitsa, if you see the Charti Chikitsa, we can get plenty of yogas with Billu. Why that is used to means because of this. So in the present scenario conditions also, we can depend upon the Billu for its Sangrahito. So excessive secretions is that is occurring in the lung-like tissues or interstitial tissues of the kapha area above the umbilicus or the chest areas. If it is occurring and excessive secretions are occurring, we need a Sangrahito to prevent that type of secretions and prevent excessive movement of the vayus. So on that condition, Deepaniya quality drug which is having a Vada Kapha predominance and the Sangrahito Billua is advised. So if you see that Billua, it is one of the Shodhaharam. So it is edema, it is good. It is an Arshaknam also, Asthapanavugam also. Especially the root which is very good for Tridosha Shamanam and the Chardiknam. Villomulam, Tridoshaknam, Chardiknam, Madhuram Laku. Dharmendra was mentioned. It is a Madhura Tikta Dravyam with Snigdha Lagu Gunam and Ushna Viryam and Kadul power. So here we can expect a Vadahabharam and Shulakna action. So wherever there will be an abdominal pain and Gulma-like features, there also we will use this Mula. So Villoadi Kashayam we can see in Chardi and Laja Villo Siddha Kvada in Chardik Paramhida. In Sahasrayogā, it is mentioned that those who are suffering with too much of such type of problems, maybe due to renal failures or sometimes there may be increased creatines also, that also will lead to these types of chardis. On that, you can prepare a payam with the Laja and the Villo Mula. Or we can prepare a kanchi like things with rice gruel, and there also we can add the Villo Moolam and Laja to that, and then it can prevent the chardi of the such type of things. So as a Pathyaharam also, in various types of disease condition, we can advise this Villo. Then one of the important thing is in various types of Shwasakasa, in difficult of the chest and taking the birth, Villo Kashaya, one pala of the Villo Moolam, and that will be taken with the 8 parts of water and reduced to 1 part, and that will be given in divided 2 doses along with the Jiraga, then it will be effective in such type of Shwasa problems. It's difficulty in taking that, maybe in the types of things which is having a pleural effusions like that conditions also we can advise this one. This from the Sahasrara. And another important yoga we have to look is in the cardiac pains and difficulty in the breathing. So sometimes the patient will tell that little bit walking or little bit climbing a step, they will feel an exertional dyspnea. So these types of exertional dyspnea, one of the very good combination that is mentioned in Sahasra Yogam is the Panal Veradi Kashaya. Panal means a Glycosmus pendaphylla. So we have planted a small shrub, Glycosmus pendaphylla. Along with that, we can use Ikshumulam. So Ikshumulam, Glycosmus pendaphylla root, Ikshumulam, then Laja, Shundi, along with this Bilwa. So these drugs, if you make into a Kashayam and it is taken along with the Jiragam, then these types of dyspnea and excessive Shwasa Vikaras will be subsided. So like that, Bilwa is a drug which is acting on these types of kapha predominant area and can promote a very good action on prana and Udavoha related disorders. So invariably, we can select this drug with any combinations or along with any other drugs for these types of vigaras occurring on these particular things. And especially in the nasal problems and in the ear problems also, we can depend upon this. So this is specifically mentioned for the root. So the other parts, the leaves also having such type of action on these areas, and the fruit and other things that is occurring on the Adhisara-like condition, Apakophala. So that everyone knows. So that Apakophala problems. So here we will discussing only about the root. So here we can see that these 3 drugs, one which is actually acting on the Amashyam and Pakvashyam area, other which is having a specific action on Pakvashyam and Grahani area, Adivisham, and this drug which is acting on the upper part of the body, Villum, especially on the Prana Udhana areas. And these all 3 drugs are having a specific Sangrahito property and having a various different line of pharmacological action on that particular conditions. Next, one set of drugs that is mentioned by our Acharyas, which is very important in clinical conditions, is Sangrahika Raktapitta Prashanama. because Rakta and Pitta are closely related, and any bleeding or such type of Rakta Vikruti that affected the body, because Rakta is the one of the important Drava Dhatu, that is a Jiva Dhatu that will be circulating around all over our body. So if something looseness or excessive Dravatvam that is occurring in that also will be a problem. Something Guru and Sthiratvam that is occurring in the Kadinatvam that is occurring in the Raktadadu, that is also a problem. Something excessive Saratvam and bleeding will be occurring, like that conditions also we need this Sangrahi Rakta Prashna. So here we can see various types of drugs that is mentioned by our Acharyas. Kudajato, Sleshma Pitta Rakta Sangrahiga Upashoshana. One which is acting specifically on Sleshma Pitta and Rakta and do a Sangrahi action and Shoshana. And another thing is Utpala Kumuda Patmaga Kinjalagam Sangrahigo Rakta Pitta Prashna. So Utpala, Kumuda, Padma, all these stamens which is having a specific Sangrahito action and Rakta Pitta Prashna. And another is Kashmiriya Phalam, Rakta Sangrahiga Rakta Pitta Prashna. And another is Ananda Sangrahika Rakta Pitta Prashna. So we can go through one by one like that. So first we can go through the Kudajatok. Kudajatok Sleshma Pitta Rakta Sangrahika Upashoshana. Here also one of the Logapurisha Samanyavada we can see how our Acharyas are, or how the first people who invented this can identified the use of this, that it can be used for an excessive movement. A plant which is growing in Kudadesha, where there will be a hilly areas, where there will be a Vayu is very predominant, and the storms are coming, and that plant has to sustain on that particular area. It will accumulate more Vayu Mahabuddha on that, along with the Prithvi. That's why it is a Kashaya Rasadrivya. And if you see the olden barks of this tree, we can see that the fold will be similar to that of intestines. So when there will be an excessive movement of the intestines, we have to depend upon this Kudaja. It's a very Tikta Kashaya predominant drug, and Laguruksha Gunam, and Sheetam, and Kadupaka. So this drug can be used for Sleshma Pitta Rakta, where there will be Kapha and Pitta Rakta involvement is there, where there will be an Ardra Arshas is there, where bleeding from the rectum is occurring, or there will be a mucus mixed with Adhisaram is taking place in amoebic dysentery like conditions. This is one of the very good drug that we can use. So many way of using is there, everyone know about. Something we can discuss here is, one is Rakta Adhisara, Kudaja Phala Peya. Kudaja Phala Peya is mentioned, that's Indreva is using there. In Rakta Arshas, Kudaja Top Kashaya, along with Nagaram is mentioned. That's by Charaka Chikilsasthan. Here also we can use this Kudaja bark as a payam also. We can put the barks in the gruels when we are preparing, and that gruel is giving also will be useful in various difficult conditions. So what the importance means, if someone is having a too much of problem with related to the abdomens in the lower part of the abdomen, especially in the Pakvasha, where there will be a sigmoid colon and anal regions, and some untreatable diseases, maybe a malignancy like conditions also, we can depend upon such type of drugs to pacify and do a symptomatic treatment qualities, that so that the patient will forget about the symptoms, at least we can promote like that. So selecting on such type of drug is important in these cases, where there will be Raktasrava is there, we can utilize these types of things. In Adhisara also, in severe Adhisara also, Kudaja Kudapaga Swarasam, Kudaja Kudapaga Shirapagam, sorry, Kudaja Shirapagam is also very useful. And in even Ardra Arshas, in Sleshma Adhisarams like conditions, and because of its Laguruksha Tikta Kashaya Rasam, we can use this in external labors also. If sometimes there may be an effusion is occurring in a particular joints, and there will be too much of heat, and we need to shrink out that particular swellings, we can use this bark for external applications also, labors on the knee joints and such like. So only thing we have to differentiate is it that swelling is cold or hot? If it is a swelling is Ushna, it is there, and inflammation is there, surely we can go for this. But in the cold condition, don't go for this Kudaja bark applications. So like that, there are plenty of applications is there. And another important drug which we can depend is the Utpala Kumuda Pinjalaga. So this is a drug that stamens, a plant which is occurring on Anuba, watery areas, and it is having a plenty of Aptattva predominance along with, if they want to sustain, it has to maintain a Tejo Tattva and Agasa Tattva. Especially the stamens are having such type of predominance of Tejas and Agasa Tattva with the combination of Aptattva. So that's why it is having a very important action of Tikta Madhura Kashaya. So these Mahabhudas will reflect it in the rasas in the form of Tikta Madhura Kashayam and Legu Sniktha Pichilam. So sometimes in a excessive Srava is occurring, we need a Pichilatva and a Legutum that can shrinken out these things to make a solidification of that particular area. And it is Shida in nature and it is Vibhaga is Madhura. So wherever there will be an excessive Ushnatum that is occurring in the blood, where the blood components will be becoming very loose and the fluidity of the Dravatva of the blood is increasing in the various Rakta like conditions or in the various conditions of blood cancers like conditions. One of the drug we can depend is this one, the stamens of this. So one combination is the stamens along with equal quantity of laksha make into a kashayam or shirapakam is very useful in preventing such type of bleedings inside our body, especially in the more conditions of malignancies or maybe of that of the blood cancer like conditions. We can use this one. And if you see that the usage of this in even in excessive bleeding from the arthrosclerosis. So where there will be an excessive bleeding in the arthrosclerosis, we can use this churnam along with madhu, or in any other combinations. You can add this stamens powder to that, and it will be very useful. Some of the yogas are Sarasita Magarakhanda Churnam is there in Rakta Pradaram and Sahasrayogam, and we know that there will be Aravinda Asavam, like combinations are there. That will be a very good for promoting the growth of the children, and same time it can promote a very good calmness of our brain and related things. So in that way, this is one of the very good drug of choice in various skin diseases, Visarpam like conditions, and in Varnium areas and Trishna, Daha, Vishakna. So a condition where there will be excessive rukshatum that is occurring in body, there also we can utilize this in various forms. So another area where we need is a drug that can promote a very good qualities to the heart and other places. So one which is having a Kashmiri Phala, which is having a Raktapitta Prashmanana quality, and that can act as a very good Hridyam also. So this is one of the very good drug we are not exploiting properly. Especially this drug has praised by our Acharyas in so many places. So Acharya Sushruta has telling that Hridyam, Mutra Vibandhakinam, Pitra Astrak Vadanashanam, Keshyam Rasayanam, Medhyam Kashmirya Phalam Uchyate. So this phala is having a quality of Mutra Vibandhakinam, Pitta Astrak Vadanashanam, Pitta Rekta Vada problems, and Keshyam and Rasayanam. So nowadays, so many people are complaining about excessive hair falls and mental tensions and other things. So Drakshadi Kashayam is one of the small Kashayam that we are using for these types of mental problems and abdominal related problems like that, excessive heat and other things. We can depend this phala, Kashmiri phala, on that Drakshadi Kashayam as an ingredient. Nowadays, most of them are using the moola of Kashmiri. But in the Drakshadi Kashayam, if you add this phala, it will having a very good action on such type of condition, especially and excessive secretions of the gastric juices and gastric acidity, and that is related to the mental problems also. So someone is having a tension, then same time the acidity also increases. On such patients, the Drakshadi combination is very effective. Or if you are getting these fruits can be do a kashayam or as a shirabhagam also. This will be a very good thing. So this shirabhagam is also mentioned in our classics, especially by our Sushrudacharya in Hridyam, Keshyam, and Rasayanam qualities. So this is one of the very good drug that can be selected for various types of such type of problems related to the Manasa and Hridaya related things. And even in Adisar, the Yusha prepared with this Kashmiri phalam is mentioned by Charagacharya. So Kashmiri fruit is one of the unavoidable thing that can be used for various types of problems, especially this fruit is having Madhura Rasam. Madhura Rasam along with a Kashaya Amla. So just like an Amalak, it is also a very Madhura Amla and it is Guru in nature and Shida in nature. So excessive heat that is occurring inside our body, it can be pacified by this drug and it is Vibhagam is Madhura. So in that instant, this will be one of the very good drug that we can choose for various types of Rakta related problems that will be taking place inside and where there will be Ranjaka Pittam along with Vyana Vayu is involved. Vyana Vayu excess activity is taking place and such type of heat is generating, then we can use for this drug or one of the choice. And another is again the Pitta and Rakta will promote so much of heat in our body. So such type of a heat increasing has to be subsided in various ways by externally or internal medications or by some panams like conditions. So this is a drug which can balance these heat in our body related to Pitta and Rakta. So Anandamulam Sangrahika Rakta Pitta Prashna. So that can also prevent the bleeding from various areas of our body. And this is mentioned for Snanam, Panam, Uddvardhanam, Pralepam. So we can use this drug in various forms. So Hemidesmus indicus, this is one of the very important drug of choice for such type of problems. So unfortunately, one of the important thing unfortunately, we have to think about one of the important factors selection of this particular drug. So most of the time, if you see the market available samples, it's all of Decalyptus hamilton. So Hemidesmus indicus is the specific Sariva that is mentioned by our Acharyas. So we have to select this Hemidesmus indicus for this Sangrahika Rakta Pitta Prashna. And even in various types of bleeding related to Arshas also, Sariva Mula Churnam taken along with Takram is one of the indication that is mentioned. So here you can see that Tikta Madhura Rasa predominant dravyam and which is having a Guru Sniktham Shida, which is having a Guru Sniktha Shida and Madhura Vibhav. So in that way, it can promote a coolness and can promote a Stiratum to the Raktadava. So later we saw that one which drug which can prevent the more Saratum. So here we need a more Stiratum to a particular where there will be excessive flow of these things has to be prevented. On that condition, we can use this drug for that purpose. So in any Kushtam, Kandu, teachings where there will be Srava is more, where there will be a more excessive sweatings like things and Raktapitta like conditions, we can use this as one of the important things. So that's why in Pradara conditions, in Adisaram, and in various types of even antiviral properties conditions also we can use this Sariva. A recent pharmacological study is revealing that an interferon compound that is present in this Hemidesmus indicus can act as an antiviral drug also. So one there will be Jora is crossed the Ama Avastha. We can use these types of drug which can promote an ideal balance of Shidatum in our body. So one of the important yoga is Shadavari Gopaganyadi Kashayam in the Raktavita Chikitsa that Acharya is mentioned in Sahasra Yoga. So various types of bleedings, especially in the liver related conditions where that there will be small rupturing of the veins and other things are taking place inside the Amashyam or this Shadavari Gopaganyadi Kashayam is one of the effective things. And another is the Shadavari Kashayam that is mentioned for Krishna and Raktavita. So excessive thirst, especially related to the Prameha-like conditions and diabetic mellitus, advanced stages, there also we can use this Shadavari Adi Kashayam as one of those foods. So like that, even in Grandhi-like conditions where there will be more Grandhi is occurring on the hot seasons, abscess are occurring excessively in the summer season. On that conditions, we can advise the Pana of this Shadavari Mula. So 1 liter of water, 1 teaspoon of this powder root churnam we can serve and it can be and it can be taken so that it will be very useful for that purposes also. Like that, Ananda is a Sangrahiga Raktapitta Prashmanam we can use it for various diseases, especially related to the Raktavasrodha Vigaras. So after completing this, we can go through another important area where most of the time our clinical patients are coming with these types of problems, especially Vata. So Vadahara Sangrahi Dravyas, Sangrahi Vadahara Dravyas. So when we are seeing this, Bala Sangrahiga Belya Vadahara, Krishnaparni Sangrahiga Vadahara Dibaniya Vrishyana, Vidariganda Sarva Vrishya Sarvadosha Harana, Amrada Sangrahiga Vadahara Dibaniya Sleshma Shonida Vibanda Prashmanana. So these qualities are mentioned by our acharyas. So we have to select the particular dravyas for that. So if we can see that Bala Sangrahiga Belya Vadaharana. So a patient is coming where there will be an excessive movement of something is taking place and excessive chalana. Sometimes there will be a mutra disar, excessive mutra is going on, and the patient is having a severe Vataja problem. So we can surely go for a Bala Shira Kashaya. So that is mentioned in Mutra Disara. So in Prameha, like conditions also, if it is a patient is severely weak and there will be a frozen shoulder, like conditions are there, we need a Belya Vadaharanam. We can go for these types of things. So Bela Sangrahiga Belya Vadaharanam is in such type of conditions. Same way, the Prishnaparni. So sometimes we need a Sangrahanatva of a specific Dadus. There also we have to depend upon such type of thing. And moreover, the Amrda. So we can go through one by one, where the Vadaja diseases we have to this. One is the Bela Sangrahiga Belya Vadaharana. So here we can see that the Bela has having a Madhura Tiktam and a Legus Niktham. So most of the time, the Vada has having a predominance of Viruksha. So Sniktha Guna property with this is very predominantly present in the Madhura, with that Snikthatum is present in the Bela. So we have to select the Bela which is having a Shila Virim and Madhura Vipaga. So that which shows that it is a best Vata Pitta Bharadravya. So a patient coming with any Pittaja symptoms like Pramam, any burning sensation of a particular part, sometimes there will be a neuritis associated, there will be a burning sensation. We have to think about a drug which is having such type of quality of Vata Pitta, and one of the excellent is Bela. And to potentiate that actions of this Vata Pitta Haram and Rasayana qualities for even in India, our acharyas are formulated the Avarti, the repeated preparations of Bela, and to make the Sahasrapagam and Shadapagam. So Bela Kashaya Kalkapyam Tailam Shira Samam Pajet Sahasra Shadapagam Va Vadastra Vadaroganit. So where there will be Vada and Asrak involvement and Vadaroganit, maybe a rupture on that on the brain blood vessels, or there may be any something is happening on such type of areas where we need a Rasayana Midam Cheshta Indriyanam Prasadhanam. So this is one of the very important thing, that is these avartis are Rasayana Midam Cheshtam Indriyanam Prasadhanam Jivanam Brahmanam Suryam Shukra Asrak Doshanashanam. So for the brain related Sangrahi property, we need along with Belya Vadaharana, one which promote the Bela and other things. This is one of the important. And another important area is when there will be a Shukra-Swanada Samyoga is occurring and the fetus is started to grow, there may be a chances of abortion, and we need a proper growth of the fetus and the mother's structures. Especially the mother's structures, pelvic girdle will be enlarged, the ligaments will be flaccid, where there will be a more excessive things are needed, nutritive things are needed. One drug which can promote such thing is Bela. That's why Bela Shirapaga is mentioned in all the 9 months. So for the 9 months, if you give this Bela Shirapaga, it will be a very nutritive things to the child and the mother. So like that, the selecting of that Sangrahi quality in multi-level along with Belya Vadaharanam is possible with Bela. So sometimes there may be an excessive triggering or tremors that is occurring on the fingers or some part. We need a Sangrahanapur. So on that conditions also, a Bela predominant preparations like Avarti if you are giving, we can get a very good result. So in that sense, this is one of the very good choice. When there will be an excessive movement of gases that is occurring inside our body, peristaltic movements may be there. There also Bala is one of the important choice. Sometimes there may be an excessive beat on the heart, and we feel that the heart is beating too much, and maybe related to thyroid related conditions also. We can select Bala as one of the ingredients for that prescription. In all that such instance, we can select this Bala. Sometimes the patients are complaining about the excessive movement of the eyelids. There also Bala is one of the important. So like that, Acharyas are formulated so many yogas. If you we go through that yogas, we can see Bala is one of the predominant thing in that such conditions. So one is the Haubahu Bala Kashaya. 1 month, if it is taken, then it will be Bahu Vajra Samanavat. So it will promote the Bala, and it will promote the Sangrahanato of the joints and other things, and it will be a very good thing for the shoulders. So that's by Chakradatta. And like that, it can be used in Parishekam, Avagaham, Basti, Pojanam. Like that, anywhere you can use. Bala Jiragadi Kashayam in Swasakasam, Bala Bilyuadi Kashayam in other yogas. Like that, we can see so many plenty of yogas. Another important drug is, we can see the Krishnaparni. So Krishnaparni and Shalaparni are coming together most of the times. So Acharyas are formulated in such a Sushma form that these drugs can promote a very important action of Deepana, Vajanam, along with a specific Sangrahanatva and Rasayanatvam to the body. So this Rasayanatvam is promoted by this Stiradoyam. So why it is called as Stiradoyam means these two drugs can promote a Stiragunatvam to our body. So again, in the first trimester of the pregnancy, we have advising this Bala Doyam for the Shirapagam because we want that Stiratum. So that Stiratum is necessary to hold the things on that particular way. So after the Bala, the second choice where we can depend on these types of pregnancy condition is this. And it is having a specific Deebaniyam also. That is the specialty of Krishnavarma. So, and it is Vrishya. So this Deebaniya Vrishya quality along with Vadaharatam can attributed to the heart also. So because a Sangrahitum in Vadaja predominant Hridrogas, if you see the Chikitsa, these Prishtaparni, Parni Dwayam is extensively used, especially the Shirabha of this Parni Dwayam is mentioned in Vadaja Hridrogas. So there we need a Vadaharatum and Deebaniya Vrishya. So on these conditions, we can use this Krishnaparni. So what the specificity of Krishnaparni and Shalaparni is? Krishnaparni is Madhura Tiktarasam. Shalaparni is also Madhura Tiktarasam. But Krishnaparni is having a Madhura Laghu Snikta Saraguna. Laghu Snikta Saraguna. That Shalaparni has Guru Snikta. So that is the difference. So here both these are coming together. Then we can get a very predominant of Laghu Guru combination and Snigdhatvam along with the Sara property. So this is one of the important thing that is needed for Saumya Dhadus or Saumya Srodho Moolas that is existing inside our body. And both are having Ushna. Because of that Ushna, it can pacify the Vadam and Kapam very well and can maintain the Agni in a proper way. And it is Madhura Vipaka. That's why it is these two things are Rasaya. Even from the Vedas, if you are seeing, the Prishtaparni is considered to be one of the very important drug in such type of conditions. So a common available drug that we can use for various types of purposes, Desmodium Jangeticum as the South Indian source, sometimes Uraria picta in the North India that is using. Anyway, both these are having the same qualities, we can use that, no problem. And this is having a Sandhaniya quality also. The churna of Prishtaparni Moolam and prepare a meat soup prepared with, especially goat soup prepared with Prishtaparni Moolam. 21 days if you are giving, then it is useful in Asti Pagnas. Even in osteoporosis like conditions also we can adopt these soups. If someone is taking non-vegetarian, then it is good. In Hritkada Shulam, Shirapaga is mentioned. Like that, these things are useful in Shwasagasa Rogas, in Madhyama Roga Margas, And even in Mutravaga Srotas also, it will be a very good drug of choice for Sangravi Deepan fire. And this Shalaparni also, that's Sudarthria Visra that is using in South India. If other sources that will be available in other places also having such type of same qualities, that can be also used. Another important and most frequently used drug we always have to think is the Amrita, because of such a dimensional Agraushadha karmas. So among the Agraushadha karmas that mentioned by our Acharyas, this drug is having a very predominant diversity of pharmacological action. Sangrahi, Vadahara, Deepaniya, Sleshma Shonida Vibandha Prasmanana. So one which is very Sangrahanatum and it is having a Vada Haratum and the same time and Sleshma Shonidam. So there will be a combination of Sleshma and Shonida is occurring. There we have to depend upon this. That's why in Rakta, if you see on all types of Rakta and the same time in Vadaraktam extensively use of Amarda and Vibandha Prasmanam we can see. So this is a drug which is having a wide range of activity in various dadus, almost all dadus we can say. And this is a drug which can replace the improper or excessive problems of gunas that is occurring on our any dadus related to saram, yuksham, tishnam, ushnam, laghu, dravam. So in any dadu where there will be saratva is more, yukshatva is more, tikshnatva is more, ushnatva is more, laghutva is more, dravatva is more, then we can think about this Amrita. So we can see that this is occurring in almost all dadus. So from Jwara Chikitsa to Vadarakta Chikitsa of our Chikitsa Granthas that mentioned the yogas, Acharyas are extensively used this Amrita for various parts. So in short, Amrita is one of the drug that can be used by simple changing the Anubanas. Virdhena Vadam, Saguda Vibandam. So it is Vad we can use with Virda. Amrita, Shayam, Vivana, it is pacifying or Saguda Vibandam. If it is a Vibandam, Buddha we can use. Pittam Siddhatyam. So if Pitta is predominant, we can use the Siddha. Madhuna Kavascha. If there will be Kapha is more, then Madhu. Vadastra Mugram, Urupada Mishraya. If it is given and mixed with along with this Eranda Tailam, then it will be a very good for Vadarakta. And Shundya Amavadam Shamayat Gudiji. So if it is giving, the Kashaya is giving along with the Shundi, then it will be good for this Amavad. So like that, a single drug, if it is on the clinic, we can use this drug in a single form or with any combinations. We can use for various types of diseases from Rasavagasarodosis to Vectorosis. So especially in Vadarakta-like conditions, nowadays we can see that so many autoimmune diseases, and we can't able to sometimes to give a name to that particular disease, but we can select these types of drug that can having a specific Srodha Pratyanigatum and Vyadi Pratyanigatum to that particular area, and we can make this drug as the main guiding drug to treat such type of conditions. So we can see these usages in Prameham, excessive Prameha-like conditions. We can see in Rasayana, we can see these things. And as a Sandhaniyam, we can see. So especially, we can see one Amrutotram Kashayam combination. Amrutotram Kashayam, Amrita 6-part, Haridaki 4-part, Shundi 2 parts. Guda Lavana along with this is a common Amrutotram Kashayam. So Amrutotram Kashayam, if you add Punarnava, we can use it in the Shodha. So in this combination, if you add Amrutotram Kashayam along with the Sarivam, it is very good for Prameha. And if you add this Amrutotram along with the Trivurt, it is very good for Udara. Amrutotram Kashayam, if you are add with Eranda Tailam, then it will be good for Amavada. So like that, in the rheumatoid conditions and other things, we can use this Tikta Kashaya predominant drug with the Guru Snikta Gunam and Ushna quality. So it is having a Ushna quality, Guru Sniktam, and at the same time it is a mother part. So this is one of the divine drug that we can use for these types of problems. Presently, these COVID-like conditions and after the COVID, this is the drug which has to be a choice for regaining the proper maintenance of our body in a level. So we can use a combination of Amrdarishta or Amrdottaram, Amrdarishtam. So this is an unavoidable drug. If you see the Ganas, you can see that it is a Krishna Nigrahana.
Kindly, sir, conclude within time because another speaker is also waiting.
Sorry, I will conclude this. So along with the Trishnandi Grahanam, Daga Prasmanam, Stanya Shodhanam, this is one of the very good drug options. So this is one of the important thing that we have to do is Jnana Vidhi Aushadhanam Jnanam. So proper knowledge of the drug is very important, and on that also Vaidya Guna is this combination of these drugs. So according to that, we have to select this by looking into the Vada Pitta doshas involvement, and there will be the Pradhanita of that particular case. So thank you all of you for patient hearing, and thank you to giving an opportunity to share of these specific things to all of you. Thank you very much.
Thank you, sir. Thank you. So very nice presentation and very impressive presentation. Actually, this is actually so many participants are enjoying these lectures as in Facebook also, as well as after some time this lecture will be available on the YouTube page also. So now I would like to invite our another speaker as Vishwanath S. Dr. Vishwanath Ji, Vishwanath S. Vashedhar is a BMS MD in Panchkarma, studied under graduation from KHERS Sri B.M. Kanwadi Ayurveda Mahavidyalaya Belgavi, and compiled post-graduation in Department of Panchkarma from Sri Dharmasthala Manjunatha College Ayurveda, Kotapadi, Udupi, and presently working as Associate Professor in Department of Panchkarma in KHRS Sri B.M. Kankanwadi Ayurveda Mahavidyalaya Belgavi. So I hope that Dr. Vishwanath S. Vashedhar is already here. I hope that Dr. Vishwanath Ji, yes, I'm just making you sir co-host, and you can also share your screen. Please open your camera. Yeah, so kindly, yes, welcome sir in this platform, as this is a very important platform. As you know that this is on the memory of Dr. Rishi Ram Koirala, who is a very well-known physician, who was a very well-known physician of Nepal. And so we are just organizing this program. So welcome, sir. Today's, we all know that today's topic is where Dr. Vishwanath Vashedhar is presenting his presentation on Ayurvedic understanding of and management of muscular dystrophy with relevant case presentation. So this is a very perfect presentation which is needed by so many Ayurveda clinicians. As I am just watching that 77 participants have already joined, and many of them are watching in the Facebook. So welcome, sir. So now the stage is off. Now the stage is yours. So start your presentation, sir. Thank you, sir.
Thank you, sir. Thank you for the introduction. I'll share my slides now. My slides are visible?
Yes, well visible and audible, sir. Yeah.
Good evening, one and all. Today we are seeing muscular dystrophy in Ayurvedic perspective and some amount of the management. Okay. Starting with my presentation, Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Sri Guruve Namaha. Whatever I am going to talk today on this topic, the gurus which are given to me, and if any mistakes, this is from my pocket. Okay, with this introduction, we'll start. So before going to the topic, little bit we have to look into the theoretical part of understanding of muscular dystrophy in contemporary sciences as well as in Ayurveda. With this is a disease where there is a progressive hereditary degenerative disease of skeletal muscles and involvement of the symmetrical muscles weakness, and especially a proximal muscle weakness and atrophy. there is a classified clinical types of patterns of inheritance. This is very important, the inheritance and by the abnormal gene or it's a protein production. This is a major positive factor which was till date identified in the current available contemporary sciences. Next. This is the classification. Muscular dystrophy can be studied under three headings, that is X-linked inheritance, autosomal inheritance, and mitochondrial inheritance. Because these all things are the way of understanding of the clinical pathologies and why this disease is happening. So X-linked inheritance, autosomal inheritance, and mitochondrial disorders or ciliopathies can be under the consideration. Inheritance diseases, each human cell contains about 44 autosomes and 2 sex hormones. Autosomal inheritance is classified into dominant and recessive. That you have to basically learn. Dominant and recessive. Dominant gene expresses the disease and recessive gene will carry as continue as a carrier. Sex-linked inheritance is determined by the gene present on the sex chromosome, X-linked or Y-linked. That is what is going to our topic. This is the autosomal inheritance. This area I want to concentrate more because it's the biggest presentation. I cannot conclude in a shortest period. I will go fast, very fast. These are some points. There is a inheritance, autosomal inheritance. There is a father and mother is sharing a disease. Then there is a chance of birth of 4 babies. In that, 25% will be normal, 50% will be carrier, and 25% will be affected. This is very important. By this chart, we can predict the progeny, how there is a offspring is going to take place. This is what explained in detail. Already you know this chart. Then this square is very important. Punnett square, maintaining between the normal and if the marriage is in between the normal and the abnormal. So the carriers are 50% and the normal are 50%. These all will count in the disease entity. Matching between the normal parent and affected are carriers. These are the basic information which you need to know. So once I'll come into the Ayurvedic perspective, I may discuss these points. Matching in between affected parent and an affected mother and father, then there will be 100% affected offspring will be noted. Then genetic counseling is a pattern. Why I did all this, reviewed these basic points, you may be knowing this, because now there is a latest trend in genetic counseling. The couples having the family history of genetic disorders or the structure abnormalities, advanced marital ages, like above the age of 30 years they are getting, these things should be explained to them, and you can suspect to have such couples having the previous child with a genetic abnormality like DMD, MPS and Down syndrome, etc. You can explain them the prognosis or what may be the outcome. Then ultimately you can tell for the adaptation also. Then conceptual analysis, what is the genetic disorders, what are the genes and how these all things already you know this, and chromosomes contain the DNA in the densely coiled manner, means where exactly the defect is there, undergoing about the 10,000 times reduction in the length. Because it is coiled means 10,000 times of its length is reduced. Genes are segment of DNA which contains the information, that is a code information, because these are the basic information of the genetic content I am explaining you, because the same thing has been dealt in Ayurveda. I'll come to that one. These are the basic explanation that this is the coil where there is the 10,000 times it has been reduced. There will be written coding on this. There is a markings which I mark on my website, thymine, adenine, cytosine, that is glutamine. Means this is the coding where there is a proteins are fixed on the DNA strands where there is a our outcome has been decided. This is the still more innermost part of the gene where exactly a double stranded DNA will make the content of the proteins presentation will make the disease or normal entity. See, this is the regulation of the gene function. How the gene is going to get function, because of there are more than 30,000 different genes in each human cell. The large number complex ways in which genetic activity can be controlled is not surprising. The second point is also there is important. The gene controls systems are especially important for the controlling of intracellular concentrations of amino acids, amino acid derivatives, and intermediate substances, and products of carbohydrates, lipids, proteins, and metabolism. These all are the nowadays learning of the gene after the invention of the electronic microscope. So many things are came and then they learned this much. Then what is being done? What to be done? All these studies are based on the presumption. See that the word was presumption that human body is an independent biological self-regulating system. Given vast amount of data inputs, it needs to be processed, and accordingly specific gene among the 30,000 need to be activated. Means there is some code is going to give that sent information will be processed into the gene. It will kept as a memory, some are kept as an activation form, like that. One will require a supercomputer to do this job. To be frank, that much workload on this genetic inputs. In human themselves are doing it. It means they are doing it so easily without even being aware of it. Means humans are already doing it. If you know this much of work, you need a supercomputer. Or could something else be doing it? If there is an abnormality in gene coding, means the disease has been occurred. That is the outcome. These are the basic presentation of a particular topic of muscular dystrophy. There are different types, that is Duchenne muscular dystrophy, myotonic dystrophy, and congenital muscular dystrophy, limb girdle, facioscapular, and oculopharyngeal. So these are X recessive. There is an altered gene is dystrophin, and myotonic dystrophy is myotonin is the gene, and congenital muscular dystrophy and limb girdle muscular dystrophy both are having recessive as well as the dominant presentations. Then what are the things about Duchenne muscular dystrophy? First point, what to be affect on, it affects 1 in 3,500 newborn males. X-linked recessive disorder, it is an X-linked, cause mutation of the gene that encodes the dystrophin on the X chromosome. Dystrophin glycoprotein confirms the stability to the sarcolemma. The cell structure itself is lost because of the defect in the gene. Dystrophin disruption weakens the sarcolemma membrane, tears, and the muscle fiber will get necrotized. Because of this, there is atrophy will be taken place in the muscle cells. Then what are the clinical presentations present over it? Present at the birth, but the disease cannot be usualized. It may be present at the birth, but it may be visible by 3 or 50 years of the age. At the age of 5, muscle weakness, Grover sign may be positive. At the age of 6, contractures of heel, cords, and iliotibial bands. At the age of 8 to 10, walking with the help of braces. At the age of 12, wheelchair dependent. At the age of 16 to 18, death may happen. Why I am giving this course of the disease? Because you want to show the therapeutic effect of the treatment. At least you need a 20 years of treatment, so that the sufferer has to be crossed this second decade of life. Then only the treatment is going to work. Come to next. Progressive scoliosis, intellectual impairment. It may be a common verbal disability. Then death is usually secondary to the pulmonary infection and the respiratory failure, or in some due to a cardiac decompensation. Because of the in last stage of the disease, the involvement of the respiratory muscle as well as the myocardium is get involved. I'll come to that part later. This is the basic presentation of the Grover sign. Then coming to the second type, that's the Becker's muscular dystrophy. Incidentally estimated that it should be 3 to 6 per 1 lakh of male births. X-linked disorders, later onset than the Duchenne muscular dystrophy. This is the difference between the Duchenne muscular dystrophy and the Becker's. It is the lifespan of this Becker's muscular dystrophy, 5 to 45 years, affects same muscles as Duchenne muscular dystrophy, calf muscle hypertrophy, early and typical finding of this patient non-ambulatory at 25 to 30 years of life. Cardiac involvement occurs, mental retardation rare, death in the 5th decade of their life. To show the therapeutic effect or to give a good life to the patient, at least you need to wait 50 years of life. Then only you are able to tell that you have treated this clinical condition. Laboratory investigations for must to do it, that is total creatinine phosphokinase is raised 20 to 100 times. ALT and AST and serum LDH are raised because of the rate of cell death and enzyme linked between the AST and ALT and LDH. EMG can be done. DNA analysis and detection and duplication and mutation can be detected. Muscular biopsy can be to differentiate the type of the necrosis. Dystrophin immunocytometry in the DMD only. This is a specific test which you can do, an evidence test. Apart from this, in CPK values, there are another two values. You can do CPK-MM and CPK-MB is one of the another finding where the cardiac muscle involvement can be detected. That is also get utilized. When I'll come to the case history, I'll give you some information. Then what is the treatment available? Till now we reviewed about the disease. There is no known cure for the muscular dystrophy. Corticosteroids of no use. Physical therapy, speech therapy and orthopedic instruments like wheelchairs and this can be used. Recently, stem cell research is showing promising vector that may replace the damaged muscle tissue. That is how far it is still has to be updated from it. Then coming to the Ayurveda as our point of view. Hereditary concept is well established in Ayurveda. Whatever I till now dealt in very fast way, I dealt in contemporary science, as most of the things are well documented in Ayurveda. Ayurveda does not categorize all the functions of the body under the regulation of only Tridosha itself. The functions of our body are regulated in physical plane, mental plane, and the spiritual plane as well. Hence, any remedial measure needs to be addressed the imbalance of the Sharirika and Manasika doshas as well, and especially a Papa Karmajas. Yukti Vyapashaya, Sattva Vijaya, and Daiva Vyapashaya Chikitsa are the treatment modalities well established in science, and there is approach for the specific approach for the particular treatment of the disease. This will be elaborated later under the clinical approach for the healthy progeny. I'll come to the later part. Then, yes. Ultimately, they are telling that the baby should be like this and this dystrophin. There is a well-established concept of Prakriti, that is Shukra Shoni Sanyoga Yoga Dosha Utkataha. Utkataha is well commented by the Acharya that Utkataha is the Swabhavasite na Prakritihi. Dvividaha, it is of two types. Utkataha, Prakrita, Vaikritaha. It may be a Prakrita or Vaikrita. Tatra Prakritaha, Saptavidaha. It is of 7 types. Okay, means the well-depth knowledge of the Shukra Shonita Prakriti and its understanding, its the types and the consideration of the bifurcation of the disease were well established in Ayurveda. Shukra Shonita Prakriti, Kala Garbhashaya Prakriti, these are the other types. Prakriti can correlate and it may change with respect to this. So these are the influencing factors for the Prakriti, where the Prakriti is. Prakriti, Sharirasya Rupam, hold the body of Arunadatta variant, the Prakriti itself is an impact of your genetic makeup. In general, I want to tell this word as a genetic makeup. Why? Because so many things, dystrophin, so many research till date, it's not explored well, but there's established without any electron microscope, they can predict this. Then Kulaja factors, Jati Kula, Desha Kala, Vaya Prakta, Niyamaha, He tesham purishanam to bhave visheshaha bhavanti. See, Kulaja, it depends upon the tesham purusho. It is respective of that person who is involved in the progeny production. Jataha pramehi. One example they quoted here. Jata pramehi madhumenam na sadhyam taha. They told already it is an untreatable condition. It's asadhya vyadhi. By birth, there are some disorders which cannot be treated. Even they well established till date, there is no cure for this. Bija doshat. Why it is? Because it's a bija doshat. So in Kulajaha iti Pitru Pitamahadi, not only mother and father, Pitru Pitamahadi, it may be a grandfather, first generation, second generation, third generation, which year I am going to deal in coming pedigree charts. Then Shadbhava Garbhas. She means at the time of conception also there is Matraja, Pitraja, Atmaja, Sattvaja. So there are bhavas are told. With respect to that particular bhava, there are particular disorders are explained with this. Then Bija Vaikruti, ultimately come to Bija, Bija, that word is commented because of the defect in the seed itself is there, then 100% there will be a defective production also. Hereditary defects. That is, Bije, bija bhaga, utpade. See there, utpato bhavanti, tasya angavayavasya. Which part of the bija is getting affected, that part only get having disease. Okay. Then bija bhage va doshanam tat puti prajaha jayante. If the defected bija is there, then puti praja may be the outcome. That is the puti praja is nothing but abnormal progeny. Evam purusha yadi bija bija bhaga bij pradosham mapadet. When the part of the bija responsible for the production of the sperm is excessively vitiated, then it gives to the bhaga avayava vikrati. Mityapacharyanata strinam pradushe na bija doshascha. See that tatra dvidaha bijotpatti hetuhu matair pittair upachare. Bija utpatti is mataja or pittaja lakshanas. Then there are some diseases called as Adibala Purvata Vyadis. That is also a concept of Ayurveda. And Karma Phalaja. It is also Karmaja, Nirdishtam, because what the deeds we did, depending on that, there is a progenies are influenced. These are the some established facts of sometimes it may influence the progeny. Then coming to this, once this all clinical established and references which I quoted to support the well-established hereditary and Kulaja Vyadis are established. After the birth, they predicted the life of the babies. Means there was a good approach that the birth taken baby was well assessed for the Ayu Pramana Pariksha. Sharira, Indriya, Sattva, and Jivanta. Means they used to predict that Sharira, Indriya, Sattva, and Atma all together constitutes the Ayu of the baby. Then assessment of lifespan in our classical is mentioned in terms of Ayu Pramana Pariksha. It is one of the good clinical entity which Ayurveda has documented ever. It's not how long an individual will survive, instead to assess the Alpa-ayu and Dhirga-ayu lakshanas. Need for the Ayu Pariksha. Why you need the Pariksha? Why? Because Deha Prakriti Lakshanam Ityadi. Because depending upon the birth of the baby's body structure will give you information regarding that how long this baby is going to live his life. That is what they see there. They are given every part, means the approach, the anthropometry approach of Ayurveda was well established. Kesha, Tvak, Sira, Lalata, Karna, means every organ of the body has been measured, biometrically understood, and they given the characters. Means this was a clinical approach. You don't have a microscope, that is not the problem. But the approach was depending upon the part of the body structure of a baby can predict the baby's life. Then apart from all these physical characters, the other functions like Vata, Mutra, Purusha, Visarjana, how it is, Nidra, Swapna, Shrama, crying, laugh, and Dugdapana, all these should be normal. Along with this, other body parts must carry out their respective function. Means the assessment and examination at the time of the birth was well established anthropometric, which are biometric oriented. Acharya Shushita in his Sutrasthana has also mentioned that the Dhirgayu Lakshana is similar to the previous, which I quoted. And Madhyamayu Lakshana is also told. Means the assessment and prediction of the Alpayu Lakshanas. See, these are the references where the earliest assessment of the life expectancy of that particular progeny was well established. Assessment of 5, Balam Trividam, Tasmin, Deha Pramana Vriddhi, and Shleshma Udakam, Tika Bale, Kramena, Deha Pramana Vriddhir Bhavavanti, Tena Vardhamanatvena, Shleshma Adikena, Cha Balasya Snehadini Bhavanti. Depending upon the constituents of the Kapha and the Sneha, will decide that. Pancha Vishesham, Tato Varsho, Punam, Naritu, Shodashe, Samatmam, Jivet, Kushe, Bisha. The Tika Samatvam, Anga Viradi, Samatvam, Paripurnatvam Angam. The complete development of the part is to be expected. Coming to the, I want to build till now, I work out the basics of the inheritance and the assessment. Coming to the new point introduction, what that muscular dystrophy, which I am going to conclude as a Karsha, as a Lakshana. Means The present muscular dystrophy can be attributed to the karsha, that is shushka, spik, guda, udara, grivo, damani, jala, santataha, tvagasti shesham, atikrisham, stula, parva, naromataha. Atikrisha iti anena upachaya lakshanam bala bhavo darshanaha. There are two entities. One is the krisha is having either bala bhava or upachaya, nourishment and the nutritional index reduction, as well as the work efficiency index reduction. So atikrishaha alpa pranaschu kriyasu. Already in Ayurveda is well established that the atikrisha people are having alpa pranascha kriyasu bhavati. Alpa pranascha kriyasu bhavati, commented by the Dallana, kaya, vak, manasishu, kriyasu, vishesha, alpa shakti bhavati etena, shakti lakshanam bala abhave. Shakti lakshana is bala abhave, remaining alpa refers to the kaya vaka. The krisha can be understood in two ways. One is upachaya lakshana bala abhava, means upachaya is refers to the nourishment and bala abhava, and shakti lakshana bala abhava, means the krisha can be or karsha can be taken under two consideration. There is a nourishment index is less, as well as working efficiency less. Then coming to the assessment of bala, what Ayurveda tells regarding bala. Balasyatu baraharanadi shakti gamyaha, where the bala can be well assessed, where baraharanadi, weightlifting, and gamyasya, the working efficiency of the person can be taken. Sarvadhatu sar upachaya lakshanam. Even bala can be assessed on the sarvadhatu upachaya lakshanam, means all tissue, that is sarvadhatu sara purisha lakshanas, means every tissue has having its own excellence presence in the body. That is also going to give you bala. Vyayama shakti ripi karma shaktya pariksha karma shaktya hi anumiyate. Depending upon his vyayama shakti, you can predict his bala. Tatra balayo upachaya shakti lakshanayo vyabhicharam aha. There are two things, that is upachaya shakti lakshanam, vyabhichare. So bala is by two entities input. One is upachaya lakshana, how the nourishment has taken place, especially a mamsa dhatu upachaya, how it has happened, will give you a bala. That is the protein X presentation. And shakti lakshana, that is karma samartha, how efficient or how heavy we are doing the work, it is also taken under consideration. Okay. Coming to the next. Then, what is the reason for this? Adana samaye, at the time of conception, yasya shukra bhage adhiko bhavet. Adana samaye, yasya shukra bhago adhiko bhavet. I am talking earlier slide, I shown on a genetic workout and the presentation of the some proteins on the genes. The presentation will make the disease entity like that. Here, adana samaye, at the time of conception, yasya shukra bhago adhiko bhavet, medo bhagastu hinaha. When there's a conception is taking place, when the bija is contained, adhika shukra bhava and less medo bhava, hina, yasya sa krusho api mahabale. See that there is a person may be having krisha, but bala is normal. He can do physical work activity. Second, from Bhava Prakasha, medastu adhiko. If that shukra bija is or the bija is having medastu bhaga is adhiko, alpato bhavet sa snigdo api supushto va api balahino vikare. What I am telling is medastu adhiko. The person is having meda bhaga is more in his presentation, like the protein and the genetic makeup which is having meda bhaga is more. By looking person fit, or you may see him as a very fit person, but as a shakti he is having less bala. Then coming to the third reference from the Sushruta, that is mamsa sharira pushtim. Mamsa will give the sharira pushti. Medascha medaha sneha svedau drudatvam pushtim shukram dairyam yauvanam dehabalam. Means mamsa will give the sharira pushti, meda will give the drudam to the body, and shukra will give the deha bala. Shukra is not the only that we are going to give offspring. Shukra is sarva sariram, it is deha balam. Means these three entities are very important to have the bala in the role of Karsha. Then Karsha can be concluded in two headings. One is Dhatu Kshayajanya Karsha, then is another one is Karma Karsha. See, Karma Karsha, the two references from the Bhava Prakasha, that is Medo Bhaga and Shukra Bhaga, which I gene makeup and the active gene, which I have told in the earlier slides. Then coming to the Tatra Balena, Stiropajita Mamsa, Bhaya Gamanam Abhantarayam. See that, the Dalana Sarva Cheshtasu Apratipavataha Kaya Vak Mano Vyapareshu Apratihata Shaktihi. Tatra Bhaya Gamanam Vak Panipada Atma Karyani Vachanadayam Gamanam Visargam Adanam Karmendriyam Buddhidriyam Swakiyaha Karya Avabaddo Bhavanti. See that Karmendriya and Buddhendriya, these are the part of the working efficiency of a individual, where that is got hampered in Karsha. Then coming to the Karma Karsha due to the Shukra, that is Sahaja Karsha. Sometimes it is taken as Sahaja Karsha. Daurbalyam to Swabhaha. It is well established Shukra from the Shishuta Sutra 34th. Daurbalyam to Swabhavaha Dosha Jaradibhi Avashikshante. Swabhavat Matru Pitru Shonita Shukra Swabhavadi Ityartaha. It is because of the Matru, it may be Pitru or it may be Shukra Shonita is the reason for that. And Prakriti Deha Janaka Bijam, which I already established for you people. This is the comparison between the muscular dystrophy can be treated in the principles of Karma Karsha, is the newest concept with references we have taken. And coming to the treatment aspect, there is a treatment aspect, there is a preventive and supportive. Two category I can make it, because a preventive treatment is the most efficient treatment which you can plan, and the supportive treatment for the person who is already suffering, that is will deal more now in the supportive aspect, that is Ruksha Annadi Nimittetu Krusho Yunjanti Veshajam Bruhananam Balakrut Krusho Tatha Vajikaranam, means the line of management Rukshahara Vihara should be avoided, and the Brahmanam Balakrut and Vrishya Chikitsa and Vajikaranascha Chikitsa can be adopted. This is the line of treatment which you have to adapt. Rasayananam, Rushanam, Yoganam, Upasevanam, Hutva Adhikarsham Adhayet, Nunam, Upachayam Param. You have to give such a Rasayana where Vrishyanam, Yoganam, Upasevayet. The person should be given long-standing Rasayana treatment, can be well adopted. Then Swabhavat Adhikarshyo, Ya Swabhavat Alpavavat Swabhavat Abalo Yascha Tasya Nasti Chikistam. There is no treatment is well established. Even today also there is no Sahaja Karsha, but there is no treatment as such. You can only as supportive treatment you can plan in the patients. Then coming to the approach, this is the latest approach, as I told you, to preventive aspect of treatment which I want to deal. There is a classical approach for the healthy progeny, that a progeny can be planned from the Charaka Sharira 8th chapter reference. I am going to do this. The progeny with an excellent quality is always desired by the every parent. For the same purpose, Charaka has described certain measures to process an excellent progeny. These also serve to prevent the impact of the dosic imbalance of the parents, and also to minimize the defect of the Papa Karmaja or already mutated gene. In Pura Karma, Snehana Svedana and Omana Virechana and Astapana and Anuvasana Avasthi can be planned depending upon your parents' treatment. I am telling not the sufferer who is already having a disease. I am telling the carrier, if already they detected with that in their family history, there is a muscular dystrophy history is there, then that parents has to be well treated depending upon that earlier genetic makeup workout. And Punnett square, I told you, to understand the disease, how many chances to get in a baby with a healthy progeny, that has to be worked out, and this treatment should be planned. Then Ahara for the Purusha and Stree, that is Madhura Dravya Yukta Kshira and Grita Sevana to the male, and the Tilataila and Masha should be given to the Stree. Then Rutukala Charya, I did a protocol. We did so many females with this treatment and males with this treatment. We are awaiting for the results, and one result was already we are achieved. Ritukalacharya, that is first 3 days, brahmacharya, sleeping on the ground with the blanket, take food, washing hands, and fourth day, shirasnana, shvetavastra, maladharana, and maithuna should be done. Then what is the protocol for the maithuna? That is a period from the fourth day. I'm not going to decide that male baby you want or female. Whatever the protocol is there, we are adopted it. That's what I'm telling here. From the fourth day, alternate days for the male child. And from the fifth day, alternative days for the female baby. Even Charka has given method also. When the female is in the prone position, Vata gets aggravated. Look into the what prakriti she is having, and you have to advise the type of the position. In left lateral position, Pitta gets aggravated. In right lateral position, Kapha going to get aggravated. The male should ascend the bed with his right leg, and the female should with the left leg. They should enter to the bed. This mantra should be chanted every day before going to, and every day it should be make it practice. This mantra should be, even I am using this mantra in the infertility treatment, is one of the best mantra and giving good results. And past, avoid hunger, thirst, fear, sorrow, and excessive of desire. Where then putra ishti yaga not to be done. Appropriate measures should be for the desired child. Chanting of mantra for Lord Vishnu by the Pumsavana Vidhi can be adopted if you are interested. Then coming to the Kasha complications, Pliha, Kasa, Kshaya, Shwaso, Gulmo, Arshasi, Udaranicha. The red mark things are the later the patient will cardiorespiratory. Shwasa, Kasa, Shosha, Pliha, Udara, Agni, Madasu, Gulma, Raktapitta, Annantam, Asadyam, Maranam, Chap. Even death is explained in the second decade, fifth decade, and fourth decade, depending upon the type of the muscular dystrophy. Karsha is not only equal to the muscular dystrophy. The muscular dystrophy is a part of the Karsha. Coming to the Karsha Kala, how many days? That is Yato Bij.
I think that the network is slightly disturbed. Vishwanathan ji, I think that he's lost his connection. So I hope that he will join again. So this is the international webinar series organized on the memory of late Dr. Rishiram Koirala, who basically belongs from Nepal and is an graduate from Gwalior Ayurvedic College, Government Ayurvedic College, Gwalior, and postgraduate Kaya Chikitsa from Banaras Hindu University. And a very gentle person who never shows his educative skill over his knowledge. Is a very so welcome, sir. Welcome. You're just
Sorry for the interruption.
connection was lost. Yes, yes. You can share again. You can share.
Yes. Thank you, sir. Sorry for the technical intervention. Karsha Kala is Swakala Eva Karyam Karoti. Means depending on the type of defect of the bija will decide the age of the death. It may be a second decade or fourth decade, it may be a fifth decade. Depending upon the type of gene mutation will decide the things. Coming to the next slide. Sorry. Muscular dystrophy, different parts involvement. Yes, he baga anga. The type of the involvement of the part of the gene, that part particularly involved in the disease process, that is the different parts. Then what is the similarity? Till now, what are the, I worked out, muscular dystrophy and Sahaja Karsha, that is hereditary, even in Ayurveda it is told Bija Doshaja, and different time period has been, it is a Bija Mahima, which Yasya Bhagasya. Weakness is told, Balahinata is also well established in Ayurveda, and repeated falls, that is Gamana Karma Vikriti, that is Gamana Karma Vikriti. Mental retardation, that is Buddhi Indriya, Atma Indriya, and explained in Ayurveda. Verbal disabilities were explained, and Vak Karma Vikrita is explained in Ayurveda. Respiratory insufficiency and Shwasakasa are well established. Death and here the Marana is the clinical outcome of the muscular dystrophy have been established. Here, some of the cases, there are 3 category cases. I want to give you one because of the time period I cut shorted it. This is the pedigree chart which you used to work out earlier before starting the treatment, so that we will call the parents, grandfather, everyone we will call, will do the genetic mapping, and the pedigree chart we will make. This is an 11-year boy who has came in his family. Totally 6 deaths were happened because of the lack of knowledge of the marrying to a same family member. That is the Charaka second sutra, Sharira second chapter, Tulya Godri and Atulya Godri. In that chapter, well established information is given according to them. We counsel them. Even we are giving the treatment to the parents also and kid also. When he has came to me, his CPK values are 7,006 and his CPK MB was 447. So here the established cardiac involvement was identified, and we are unable to do the Yapana Bastis in this guy, and only oral medicines were given in the form of Vajikarana and Rasayana. Like we adopted Vidari preparations and some Kulaja Vyadis we consider, and we gave Vata Gajankush and Vata Kulantaka Rasas were given. The patient was wheelchaired already in the 11th year of his life only. So after the medication, patient was shown some amount of strength in both the legs, but we are most interested treating their parents of cousins also. We are treating this patient. We will come up with in coming future days, we may come up with other blood reports of the patients, because we are treating the family, so that we are waiting for that progeny to come. Then second case what we are working was limb girdle muscular dystrophy. He was a 50-year male. He has repeatedly visited most of the neurologist and the MD medicine people, but no result. He was totally wheelchaired. When he came with all the complaints, unable to walk and stand, he came to our hospital. Then we diagnosed him as a limb girdle muscular dystrophy. These were the CPK values, and this is the CPK MB. There was no involvement of the cardiac. As the patient underwent minimum of 3 to 4 course of Rajayapana Basti with Pijichil, the patient was given oral medicine. When he was lastly came in 2017, he approached with the irregularities, but in 2019 onwards, his CPK values were stabilized and the death of the cells was prevented. He is doing his normal routine. He is a chartered accountant. He is going to everyday office on his own, both the legs. That was the outcome of this case. It's a limb girdle muscular dystrophy. Another case by name, this was an 18-year boy. It's a Becker's muscular dystrophy. Just for example, I'm giving hint, the patient was got admitted with this value of 2,883 was the CPK, and CPK MB was 35 borderline, but the ECG and cardiac fitness was assessed, and the patient was posted for the Brahmana therapy like Yapana Basti was planned. It is on 24/4/2019. The reading on the discharge date, that is 6/5/2019, the reading minimum of 50% reduction in the CPK value was identified. Still, this boy is going to college now with oral medication. He's had 3 sittings of the Basti and some Vidari preparations, and Vata Kalakutta and Vata Gajankusha medicines were given for this patient. So possible till now I got it 3 different cases. I want to present it in front of you with a very minimum shortage. If it is managed well, I'm not telling that we have treated this condition clinically completely. No, it can be well managed with the approach of Karsha approach. So many people will do Svedana as more, as I have seen that Shastikashali, that they think that no, after doing Svedana, I appreciated CPK values are raised. Even 20,000 CPK values were came to the 800, 900, which I have seen after the application of this Karsha concept as applied, and the Yapana Basti, the Shimula Yapana, Jupanchamula Yapana, and Raja Yapana we are exclusively using for these cases. Only entity that the cardiac involvement should not be there, and you can easily handle the cases, and you can support them for their day-to-day activities that cannot be treated completely. But another part of that is in a preventive part of treatment I am highlighting more, as because the approach to the parents has to be worked out, and Charakokta Sharisthana 8th chapter protocol was well established. One case we got in a normal male baby, he has given birth, but to tell normal, at least the baby has to pass 6 to 7 years. So we are waiting that whether he will come with the disease or not. We are waiting that. Patient is not well to do for the investigation of all the genetic mapping of him. That's why we are waiting for that report. Once that comes, that the first case which I explained, the 8-year, 11-year boy's parents, that treatment we did for their parents, we are waiting for to finish that course of the time of the treatment of a baby, that healthy progeny. Before the last, muscular dystrophy in Ayurveda is, it is in and around the karma karsha concept. In this karma karsha is then a unique presentation what my teachers gave me a knowledge, and with that regards we are coming up with the karma karsha as a comparative for the muscular dystrophy. And manifestation is determined by the shukra is also, so sahaja karsha is also part of the karsha here. Vajikarana chikitsa is the best line of treatment which you have to adapt in the muscular dystrophy, and Shwasa is the last outcome of the muscular dystrophy, as same as in Karsha is also same, has been established. And if you have any questions, queries, you can put in chat box. With this, thank you.
So thanks a lot, sir, for your beautiful presentation. If you have any question, you can put in the chat box. And just 1 hour beautiful presentation and clinical case presentation. That is the main thing on this topic, and it is a very important topic, muscular dystrophy. So, sir, you have already given a very nice presentation. Thank you. Thanks to all of you. Anybody from NAMSS, Suman Khanalji? Yes, there is some question from Himlata GS. Namaste, sir. Basti, how many courses should be given? It is a question from Himlata ji.
Yes, madam. Basti, in one first case, we are doing Rajapana Basti, a course of Yoga Basti pattern. We did it for 3 times. After 3 times of Yoga Basti course, the patients have started showing the reduction in the CPK values, and in further sittings, when we analyze his CPK values, there is no increase. See, already the present CPK dystrophin content will go out of the body, but the rate of death of muscular cell has been prevented. That one I want to convey. After 3 courses, I started appreciating the results in limb girdle muscular dystrophy. That in Duchenne muscular dystrophy, the boy, 12-year, 18-year boy, we have in a single course of the disease itself, there is a reduction of CPK values within a span of 10 days, 50% reduction in the CPK values.
So I think that Dr. Himlata, you got your answer, and I think that already our speaker already elaborated so well, so there is no question in the chat box. So as I want to say that this is a very beautiful session. So all of you again join this session on the coming Saturday at the same time with the same meeting ID and password. Yes, L. Rakesh ji, thank you, sir. It was very nice session, which is too informative and understanding of hereditary factors, which most of them we will miss, but based on Nidana, you have diagnosed Vyadi. So this is a complimentary comments for you, sir. So thank you, sir. So I hope that now we have to conclude this session, and just I'm giving you the vote of thanks from all the organizers, NAMSS Central, as well as the Ayush Darpan Foundation Trust, as well as the other partners from Sri Lanka, as well as the Vishwa Ayurveda Parishad Nepal, and the Health Home from the Nepal. So thank you to all of you. So we again just I invite all of you to join the next coming session on Saturday at the same time on the memory of Dr. Rishiram Koirala, the same program, the lecture series. So just thanks again to all of you, all the speakers, for joining these sessions on the Ayush Darpan Foundation Trust Facebook page. And after some time, this will be also the live on the YouTube also. And you can also watch this lecture on the Ayush Darpan Digital's app, mobile app also. You just download this app on your mobile through Google Play Store, and you can just watch this lecture on the lectures, different videos series. So thank you. So now we are concluding this session. Thank you. Dr. Suman Khanalji, thank you too also for planning this session. Thank you.